And a very good morning to all of you in Malaysia, and a warm welcome wherever you are watching live from YouTube, YoungMind Malaysia. To understand how to keep us sane, I think it's very important for us to understand also how does these mental health issues develop in ourselves. It's not a one causal factor. Usually it's more than multiple risk factors that interrelate, and sometimes it's not that easy to pinpoint which factor has caused us to cause this mood or a detrimental mental health. So I think the first step, I would say, is to have a good insight, is to try to be more aware of your surroundings, your body, what your mind tells you, what your heart feels. Because people who are more aware of themselves, more aware of the triggers, they will have a better understanding on how to cope with what triggers them. I like the model I mentioned earlier by Dr. Syuhaida, which is the biopsychosocial spiritual model, which is a very comprehensive understanding on how we understand what factors influence our mental health and well-being. And hence, I would also use that model also into explaining and how we can deal with those problems. Apart from knowing ourselves better, having good insight on what makes us feel that way, how our feelings, how our thoughts relates to our feelings, the first step I would say is to adjust what we have. For example, adjust our lifestyle to these new norms that we are living currently. Some of us, we still have this mindset that one day we want to return to our old previous life. One day when vaccine comes, we will all become mutants and then we will go back to our previous life. Actually, I would say it's very important for us to understand that this is the new norms that we have to adapt to. It might take several years. It's going to be a long time for the vaccine to take place and then for everything to become normal. But there is also a possibility that it will not become as normal as previous as it was before this. So I think it's very important for us to understand that this is our new norms and we need to try to adapt to this new life. So the first tips is actually on adjusting our lifestyle so that we have enough sleep. I believe Dr. Rosina will explain further about the sleep hygiene, to get consistent exercise, to eat well according to the balanced diet, also to cope with our triggers, also to keep ourselves socially connected with our loved ones, also to avoid those toxic people that triggers our mental health, and also to keep us spiritually connected if we have any own our spiritual means in ourselves. So that would be, I would say, a very general concept on how we can implement into how we adapt into these holidays. Some people are still in their movement control order. In some states or some countries, they're quite free, they can go out. So different people are in different contexts. I would say, if you feel that it is overwhelming, if you feel that you have tried several coping strategies and you feel that it's too much and you can't control this, I very, very much suggest all of you to come and get professional help.
Okay, thank you very much to Mr. Akil. I think very good explanation. So I would like to summarize back. I think Mr. Akil has mentioned to us, first we must have a good insight in the sense of first we must how to say accept the new norms. And when we accept, we must adapt the new norms and we must adjust our lifestyle, especially during this pandemic COVID and especially in this holiday season. So I think this is important point that Mr. Akil would like to share with us. So I think the fourth question also, I would like to point to Mr. Akif Basri. So Mr. Akil, can you share with us, currently, we hear a lot of news from newspaper about the case suicide happened among teenagers. What can we do to build up the literacy among our teenagers? Any tips from Mr. Akil? Go back to you, Mr. Akil.
Yes. In Malaysia, statistics have shown that the rates of suicidal ideations, suicidal attempts, suicidal plans has increased since 2012 to 2017. And also now we see that our adolescents aged from 13 to 17 years old, 1 in 10 are stressed, 2 in 5 are anxious, and 1 in 5 are depressed. I'm sure the same pattern is also seen globally. As also many statistics by the WHO has also stated that, for example, suicide is second leading cause of death among those between 15 to 29 years old. So I would say that mental health is a very big worry among our youth and our teenagers. Building resilience is a very good keyword in understanding and when we talk and when we discuss about the coping strategies on how to make them prevent and help them become more protected. There is a study that shows that for those adolescents in which they can label their emotions better, they are able to regulate their emotions better, and that leads them to have a better mental health, also protects them from anxiety and depression when they become older. So that means that as parents, as teachers, as lecturers, I think it's very important for us to educate our teenagers on their emotions themselves. Sometimes it's not that easy for them to pinpoint what they are feeling right now. I would say the vocabulary in Malay language is not that specific to label our emotions differently as it is in English or perhaps other languages. For example, anger, frustration, ashamed, disgust. There are many vocabularies in English that I would say there are not as many vocabularies in Malaysia, in Malay language, or maybe there are, but it's not widely used or popularly used in our teenagers. But I think that should be improved. I think we need to have better education, better advocation on knowing our emotions and knowing how to label them. For example, in our rehabilitation center, we teach children diagnosed with autism, with ADHD, with dyslexia, on how to better know their emotions. So I am feeling sad, this is worry, this is anger, this is happy, this is jealousy, this is frustration, this is disgust. And when they do know how to label their emotions, they have a better sense. It helps them as a tool for them to better explain themselves and helps them as a tool to better regulate their emotions. So I think perhaps in this very short time, maybe that would be a good first step, I would say, in which we ourselves as adults, we can help our adolescents us to better label their emotions so that they can help to regulate their emotions better.
Thank you very much for a very good explanation from Mr. Akil. That I would like to say the keyword is label emotions and also regular emotions. So I think these are two keyword, very important keyword that I think as parents, we need to educate and we need to know labor emotional and regular emotion is important. It's not shameful when we share our emotional or how to say we share our sadness to other people. So that's why it's important. So we need to teach our teenager to labor and also regulate the emotions. Okay. So thank you very much, Mr. Akil. So the next question I would like to ask is Dr. Rosina. So Dr. Rosina, the next question is about people do have difficulties in sleeping sometimes. So and some people do need to take medicines, alcohol to help with sleep. How do we go about sleep hygiene? So go back to you, Dr. Rosina.
Oh, thank you, Mr. Boon. I was just going to ask if you could bring up my slideshow again and just go to the second slide. That would be great. And then we'll discuss some sleep hygiene. Right. So often when we're experiencing stress, it definitely, one of the first things that are impacted would be our sleep. So setting a sleep schedule, and I know it sounds like a simple thing that one can do, but really adhering to a sleep schedule, so going to bed at the same time and waking up at the same time every day, it can go a long way in regulating your sleep and improving your energy levels. As well, making gradual changes. So sometimes I'll hear from people who are used to going to bed at, let's say, 2 a.m. or 4 a.m. And the next night they try to go to bed at 10 p.m. Well, that's quite a change.
Yes.
So you may want to start slowly, like trying, let's say, a few nights, even going to bed a half an hour to an hour early. That change in itself can go a long way rather than trying to force yourself to sleep, say, 4 hours early. Ensuring that your room is dark, dimming the lights. Often I will hear that people keep the lights on or they keep their TV on because it helps them sleep, but it actually can disrupt your sleep patterns over time. Similarly, and again, no judgment, but we should be turning off our phones or any screens for about 30 to 60 minutes before bed, because the blue light from these devices can really essentially keep us awake. Right? So if you shut off your phone, even if you use your phone as your alarm, so you set it up in your bedroom, but you're not looking at the screen for a good hour before bed, and then you start getting into your sleep schedule. So what do you do to get ready for bed? Right? Often I also hear from people that, okay, I'm here on social media, I put my phone down, I change into pajamas, and then I go to bed, but my mind is racing. Well, yeah, there hasn't really been any sort of change, right, from kind of the day you to the night you. So your body isn't really prepared for sleep. Something else as well, if people find that they're really plagued by overwhelming thoughts at night before they go to sleep, is to try to journal before bed. Now, your journal is your own experience. So you can do it creatively, say you can draw, you could just jot down what you're thinking. For some people, they like to write more. For some people, they write less, but it's a really great way. And research has shown that it helps to kind of separate yourself from your thoughts and prepare you for sleep. So that concludes my slide in a nutshell. But thank you so much, Mr. Boon, for helping me with this, coordinate my slides. I did also receive a message from the Young Minds coordinator that I may have to just review one of my slides briefly because of an issue with live streaming. So I'm not sure if we should just check the chat, if that's still something I should do, or...
Okay, I think we have a next question for you.
Oh, okay. Okay, sure.
Okay, before that, I would like to summarize.
Yes,
I think
certainly.
Dr. Rosina have shared with us some tips regarding sleep hygiene. So I think as it's a very good tips for us to have a proper sleep especially for us, especially during holiday seasons. So one thing that's I'm very interesting about, turn off your phone for 30 to 60 minutes before bed. I think this is a very interesting point that I think me as a moderator, I also learned how to turn off my phone 30 to 60 minutes before bed. I think I will try to do this before I go to sleep. Thanks for the very good sleep hygiene tips for us. So I would like to share to ask the next question to Dr. Rosina also. This is a question about as a mental health practitioner, what is your advice for those who are unable to control their emotional or face mental health problems? So go back to you, Dr. Rosina.
Okay, perfect. So I'll actually have you go to the 4th slide, I believe. It talks a little bit, great, that's perfect, about self-care.
Okay. Mm-hmm.
So one thing I would like to really highlight, if you're feeling overwhelmed emotionally and mentally and you're feeling really drained, take a quick look at this slide and think about how are you engaging in self-care. So self-care is essentially, simply put, right, taking care of ourselves, taking care of our emotional well-being. I believe one of our panelists mentioned that often it's easier to take care of a physical issue than a mental issue just because of much of the stigma that faces it. But as you can see from the slide, there are different facets of self-care that you can engage in. So there's physical self-care, and as we heard earlier, getting regular exercising, getting in regular exercise, walking, stretching, even doing yoga, having healthy food, regular meals, that all goes a long way in taking care of yourself and benefiting your emotional well-being. And then emotional, so definitely watching presentations like this one, learning about stress management, moving towards compassion and kindness. Again, as our panelists have mentioned, we have to move towards, acceptance in a compassionate manner because we don't know what the future may hold. We don't know when things may go back to normal, right? And that's okay, but being gentle with ourselves definitely goes a long way. And then social, so having boundaries, connecting with those support systems, as well, even positive social media. So if you're following accounts that you find cause you some stress, maybe unfollow them or mute them for a bit, asking for help. So again, if anything in this presentation you find, okay, this is getting a little overwhelming, or maybe I can't do this on my own, definitely reaching out to a professional who can help you through these times and provide support for sure. And then spiritual. So this could have, more of a religious aspect to it, or it could incorporate things like connecting with nature, having time alone, journaling, even incorporating meditation for sure. And then we'll just go on to the next slide. So I also just wanted to mention dealing with difficult feelings. And I know this was also referenced a little bit earlier, but I find for me, I am a visual person. So I included a graphic. So as you can see, there's a dandelion in a field. And the first kind of panel there says to notice the feeling. So what are you feeling, right? Where are you feeling this emotion? And then naming the feeling. So while there may not be as many words to describe the feeling, even getting a general sense of that feeling is important. And then sitting with the feeling. Sometimes when we're feeling overwhelmed, we have a tendency to bottle up things or try to push our feelings away. In my opinion, in my clinical opinion, and in my experience, those feelings are still there, even when you push them away, right? So noticing the feeling, acknowledging the feeling, that self-validation goes a long way. And then letting the feeling go. So the last panel there, that is where you may want to incorporate professional help. You may also want to, say, take a look at some YouTube videos, connect with Young Minds in regards to other strategies, but letting the feeling go, you could even try like a simple imagery practice. So if you were to picture your thoughts or your feelings as something, essentially, let's picture a stream. And if your thoughts were leaves on a stream, they're just gently moving away from you. right? They're giving you some space. We're not pushing them away. We're not saying they don't exist, but we're allowing ourselves for space. We're allowing ourselves for healing. And again, I just want to reiterate that fourth panel can be quite challenging on your own. So, using like guided meditation or a yoga practice or talking to a professional can definitely go a long way. And then Mr. Boon, if you don't mind, I'll just go to the next slide as well. So I believe our panelists mentioned this as well, but I just thought I would go into some more information. So we tend to live in a world where we kind of move towards the future consistently, or we may be living in the past. Now, this concept that I wanted to discuss is called mindfulness, and that's paying attention on purpose in the present moment. And we'll just go to the next slide, and it'll give us some ideas on how we can incorporate this. So often what I hear from people is that I'm too busy. I don't have time to be mindful, or it won't work for me, right? So if you take a look at this slide, starting with number 1, here are some easy ways to incorporate mindfulness into your daily routine. So step 1 would be pause, right? Aligning yourself to the day. Before you rush into things, taking a few moments to yourself, saying an affirmation, one day at a time. I will get through this. I will be gentle with myself. And then step 2, another way to be mindful would be to savor. So how often, especially during COVID, I don't mean to pass any judgment, but how often have some of us eaten something and not really tasted it or not paid attention to it, right? We've eaten it in haste. Again, no judgment, but if you would like to try to incorporate mindfulness, you could savor that morning coffee, tea, smoothie. What flavor is it? What's the texture that you have? That's a great way to slow down, your pace of the day. Step 3 would be to breathe. So if you think about your day, how often do you take a deep breath, right? Taking a moment and breathing in deeply through your nose and breathing out through your mouth. Even trying that a couple of times during the day. And then step 4 is to notice. So if you feel like you're always on autopilot, you're going through the motions of your life, thinking about the details, right? In the present moment, non-judgmentally, what do you see, smell, hear, feel, or taste, right? So again, you could use this with food. You could use this if, you're waiting for someone. You could use this if you're feeling really stressed out. And this is a great way to just incorporate mindful practices into your day-to-day life. And studies have also shown that mindfulness can be really effective for individuals who are experiencing depression and anxiety. So that concludes this part of my answer to this component. Thank you, Mr. Boon.
Thank you, Rosina. I think I love and I enjoy your explanations. That I would have to sum up. That's first, if we have a mental problem of emotional problem, so what can we do is first self-care. I believe that self-care is very important in terms of physical, emotional, and spiritual. I think this is a very important part that we have to taking care of ourselves first. So number 2, the point that I would like to emphasize is we have to acknowledge our feelings. That's important. When we know our feeling, we will feel we are okay. Have this kind of feeling. That's important. And the third thing that Dr. Rosina have shared with us that's important is about mindfulness. So I think it's the mindfulness is very important to us to practice in our daily life. So I think this is a very good answer that Dr. Rosina shared with us. So okay, I think I would like to pose the next question to our next speaker. That is our Dr. Shu. So Dr. Shu, this is the question from our audience. Is asking sometime the audience is asking, sometimes I do feel anxious and scared. I don't know why. So how do I manage my anxiety and get back in track? So Dr. Chu, get back to you.
Thank you, Mr. Boon. I really love the slide Dr. Rosina presented, and I really love the explanation from Mr. Akif about this emotional validation, because I think this is all about being in touch of yourself, having known your emotion, and having known how to address it and being mindful. My experience with this mindfulness is it helps with a great vast of patient. I have one patient with a very severe PTSD, and she keeps on having these recurrent nightmares, and also this very hyper vigilance about the situations that happen. And she frequently came to emergency department because of having a recurrent panic attack. But there's one time where I taught her on how to do this mindfulness, in how you stop for a while and you describe the things around you based on the smell, based on the sounds, based on the physicals, and what you see, what you smell, what you touch, and what you taste. And there's one time when she came to us. I think just recently she came, and she had a panic attack in front of me. Usually, when she had a panic attack, she will be needed to give some sedation because of it will be very severe. However, at that point of time, I noticed that she did this. Oh, I can see my pants is green color, and it is a bit of rough, and I can there's no smell, but I can see the fan is moving. I can see my husband's wearing a shirt, white shirt. So she's describing, and it is so amazing in how the attack aborted in about 10 minutes, and we don't have to give some sedation to her, which is it is a very good practice to do this mindfulness. So yeah, this is my experience on how we do mindfulness. But maybe Mr. Boon can share about what I'm going to talk about, the anxiety, because it's quite a common question, how we go about anxiety, and what is anxiety actually. Yes, Mr. Boon,
Can you
can
see
you
the
share the
slide?
slide? Yeah.
Can you see the slide?
No, not yet. No.
Okay.
All right. When we said about anxiety, people ask, why do you have anxiety? I don't have anything that I'm thinking of. I think my life is okay normally, but why suddenly I have this anxiety? But if we ask further, anxiety is all about the expectation. We do have the expectation ourselves, whether the expectation is rational or we have a very high expectation to ourselves. For example, we expected to get four flats every time we having an exam. We expected to be a very good student. We expected to be a good mother. We have expected to be a super mom. We expected with so many things that we expected to ourselves. But because this is occurring in the culture and people put expectation, so sometimes we just don't realize that this expectation can cause us to have anxiety. And managing anxiety, it's all about managing your expectation. Yes, good, next. And how to go about anxiety is when you have this ability to choose what you can control and leave what you cannot. For example, when I say about we have do this anxiety about having COVID-19, we cannot go out, we cannot go on vacations. We this is what we think, and because of that, so we become angry to ourselves, we become angry to our family members. However, I would like to bring all of you to choose what you can control. For example, we know that this COVID-19, we cannot do anything about it. It is so rampant. It is so, because it is a virus, so it can goes anywhere that this virus is wants, and the cases is increasing. However, if you have the anxiety about contracting this COVID-19, maybe what you can do is you choose what you can control. For example, you can stay at home, you can wear the mask properly, you have a good hand hygiene, and you have a good social distancing with your friends. So it is not mean social distancing doesn't mean that you don't have any social encounter with your friend, but you have a very good social distancing in terms of 1 meter. It is what the standard operating procedure is allowed. So you choose what you can control. Some say that I have depression, I have anxiety, I have so many issues in my life. I have to juggle with all the problem in my life. And I think this problem I cannot do anything about that. So I always say to my patient, all right, just imagine that this problem is like a monster. So there's a hole in the middle where there's a monster in front of you, and you and the monster is uh pull and push the rope. All right. So this monster, if he is strong enough, the monster will pull you into the hole. But if you're strong enough, you can pull the monster into the hole. However, because the monster is strong and you become weaker, so at the end of the day, so you are tired of pulling and pushing the pulling and pushing the string. But what you can do is to leave the rope, and go and moving forward. So the monster is like your anxiety, it's like your problem. So if you can't do anything about it, choose what you can control, leave it, and moving forward. All right, next one. Again, I think Dr. Rosina has explained it very well. It's a focused deep breathing. This morning, which is 5 minutes before I go online, my friend has a panic attack, and she was very scared and stressed, and she don't know what to do. So I said, deep breathing. Why do we have to do deep breathing? And people say to me, breathing. I have been breathing every day. Breathing every day. So why do I have to do this deep breathing? How do it help with my anxiety? Because when all else fail, when you cannot control a lot of things, you can control your breathing. Okay, this is the concept where when you have this panic attack, you will have this chest tightness, you have this shortness of breath, you have a palpitation, your hand and feet become numb, and your mind goes elsewhere. Sometimes you have this depersonalization or dissociation in which you feel that you are not in the world, and you feel worried. You don't know that you are go out of control. However, when all else, you cannot control your chest pain, you cannot control your palpitation, but you can control your breathing. And when you feel in control of your breathing, you feel in control of yourself, and then psychologically you feel in control of your anxiety. And this is why the deep breathing is very important, and it is a part of this anxiety management. When all else fail, you control your breathing and you structure your thoughts. Next. And this is also explained by Dr. Rosina, which is being mindful. Put a stop. Put a stop means that you stop for a while, you take a deep breath, you observe your environment, and then you go back to what you have done before. Next. This is another thing. When you have anxiety, when you have depression, there's a lot of things that comes to your mind. There's a lot of things that jumble in your brain. It is like a rambling thoughts that always come, and you don't know which one is which. You don't know which one is important. You don't know which one that you should go first, which one you should put a priority. So I always say, please write down your thoughts. Write down in a way that you can see what your thoughts are. And when you can see your thoughts, you can put a point below your thoughts that this is how I'm going to handle this case. For example, if you have the anxiety of facing your boss because your boss might be very cruel, right? Or maybe your boss is very maybe your boss like have a high expectation to you, so you are very anxious about that. So what you can do is you write your thought, right? So this is what you can do. I mean, put for example, okay, I have a boss who have a high expectation to me, and I'm very anxious about that. So this is what I can do. I can schedule my work. I can do the job properly, which is I can put the job priority. So I didn't put the job that was given to me last minute, so that I didn't have the anxiety about that. And I can sleep early so that I don't have a lot of thought, but I can good. I can wake up early in the morning so I can focus on my work. So by having your thoughts written down, you actually transfer your responsibility of thinking that cause you difficult to sleep into the paper, so that you can go to your paper at any time and you can see that I have the solution for that, and it will make you calmer. All right. And the next, Mr. Boon. And always when people say to me, how do I have positive thoughts? How do I have positive thought? I always say to them, all right, okay, it is very difficult to have positive thought when you put yourself into jadilah positive. Okay, be a positive one, be a positive. It is like saying, please don't think of the pink elephant. Please don't think of the pink elephant. So I ask my patient, please don't think of a pink elephant. But it is very difficult when you say that please don't think of the pink elephant. There should be the pink elephant that come out to your mind, because it's very difficult to put into a positive things. All right, but it is easier to put into the rational thought. And this is why this emotional validation is important. By naming your emotion is important. When you know that it's okay to feel sad, it's okay to feel anxious, it's okay that I am not okay today. It's okay to cry. Today morning, waited to me when I opened the clinic door. Waited to me is the houseman who is crying. Okay, and he's crying because he said that she has this very anxious. She wants to go to work, but she cannot go to work, and she just wanted to cry. I said to her, it's okay to cry. It's okay to cry, and I give her a place. All right, I asked her that being a rational, you have done good job, you have done well, you have come to this certain level, and healing is always a journey, it's not a destination. Being a rational, but when you have this positive, I kena sembuh, I have to recover, I have to recover, I will have to recover soon. So this is very difficult, but when you say that recovery is a journey, it is not a destination, so you become calmer, because you know that you give a time limit to yourself, and you have reduced your own expectation. All right. So next. So yeah. Well, I think that's all from now. Okay. So please, okay. Please think of the pink elephant. All right. Don't think of the pink elephant. I believe you will think of the pink elephant. Thank you so much.
Okay, I think thank you very much, Dr. Shu. I think giving tips on how to managing anxiety, I think is such a wonderful explanation to us. And let me summarize. Okay, what Dr. Shu have shared with us. First, choose what you can control. That is very important. And then, and subsequent, for a practical part, first we must focus on our breathing and be mindfulness, and do some journaling. And this is what I liked. For me, for me personally, I think journaling is very helpful to me. Okay, but for other people, it's the other way to cope with their anxiety. And last, we must have a rational thought. That I think is very wonderful. I think it's a good idea for us to have a rational thought. So I think it's thanks from Dr. Shu again for the very good tips for us how to managing our anxiety. So our second last question is from I would like to pose to Mr. Akif Basri. So this is a recent point that I want to share with ask Dr. Mr. Akif. Recently, Ministry of Health Malaysia from MHPSS have established a tele psychosocial call or online call for public. And from this psychosocial online call, around 48% caller is regarding mental health, emotional issue. And I believe that this figure shows that the mental health is a become major issue that we need to concern. Okay, my question is to Mr. Akif Basri, how to help from this 48%, how to help people who are jobless, housewife of women, student, or our frontliner, such as medical health worker, enforcement worker, and etc. So go back to you, Mr. Akif Basri. Thank you, Mr. Akif.
Thank you, Mr. Boon. I like the energy from both Dr. Syuhaida and also Dr. Rosina. I think even though we haven't prepared the points, but it all comes into the same completing the puzzle. And also from Mr. Boon itself, I think it's a very wonderful forum today. So yes, I think we, as listening helpers, we can help in terms of the emotional stress of other people. I think generally we all need to build skills on how to communicate, how to listen better, how not to brush off other people's feelings. It sounds simple, but actually many people don't do it the right way. It sounds basic, it sounds simple, but there are some mistakes in when we listen, when we become the listening helper to other people. There are some mistakes that we commonly do. The first is that sometimes we like to brush off the feelings of others, and we like to compare them with other people who are experiencing worse experiences. For example, frontliners. Frontliners are really burnt out. The medical doctors, the housemen, the nurses, due to overwork. Sometimes when their families, they will say something like, "At least you have a job. At least you are paid more than 4,000 ringgit per month. Other people out there, they don't have a job. Look at those people who are struggling." That doesn't help when we compare them with other people and then we brush off their feelings. It's better for us to validate their feelings. It's okay to feel that way. Name your feelings, sit down with your feelings, such as what has been explained before this. The second mistake is what we usually do is that we think that when people talk to us, we have this pressure to give them advice. And then we have this pressure to give them quick fix solutions to their advice, as if it will help them to fix the solutions just like easily as we expect. And then worse, if we are offended when they don't take our advice. So that doesn't help as well. So usually a human problem is very complex. Usually what they need at that time is more empathy, for us to listen to them, for us to be more empathetic, and then for us to try to understand them, for us to try to respect their feelings, and that works better rather than giving them I would say premature advice. I would say it's wrong to give all advice, but it's important for us to really understand the story first before we come to any conclusion or before we offer any advice. And the third common mistake is that when we listen to people's problems, sometimes we tend to share our problems as well, as to what we perceive as it. We try to normalize the problem, but in the end, it becomes, it focuses the attention to us, in which there is a sociologist, which she termed this phenomenon is called as conversational narcissism, in which when people talk about others, and then we listen, and then we say, I'm like that too, I also feel that way, blah, 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 and then we take the stage, and then all discussion focuses on us. But actually, that's not encouraged, because we need to become the listening helper. We need to suspend our judgment, suspend our advisors, try to listen first, try to put ourselves in their shoes, and then maybe we can paraphrase what they have just said using our own words. So I think that we all need to learn the basic skills of listening and communicating, even though it sounds simple, but I think it's a very, very important skill, especially in the world today. Thank you.
I think I totally agree with Mr. Akif Basri to such a very good explanation. We go back to basic helping skill that Mr. Akif had mentioned. First, we not try to advise, and we also don't try to first jump to the conclusions. And the most important, we must have a very good listening skill. That's one thing. I believe that when we talk listen is easy, but when we practice is very difficult, the first thing. And number two, we must have empathy that just now Mr. Akil have shared with us, and also respectful. That thing I think is the most important a point that he shared with us. I think this is such a wonderful discussion for the three panelists. So before we end our sessions, so I think I have a last question for our three speaker. So I think this question is I believe that is a very interesting that I would like to point for you. Or I think 2020 is around the corner already. I believe the next week's 2021. It's a new year for us. Before we end our session, can you all share with our audience what is your New Year resolution or wish? And any advice or tip for audience to stay healthy with our mental health? So I think the first I would like to throw this question is to Mr. Akil. So what is our New Year resolution, and so what's advice? Go ahead.
To be honest, I didn't really think through this question that much, so it's quite an impromptu answer. I think my New Year resolution, I hope to become better in my skills. I hope to hopefully continue pursue my studies in PhD. Please pray for me. Also gain more experience and become someone that can be beneficial to the society as much as possible. My advice to all of you out there, I think this holidays is the first ever holidays that it's very different because it's during the COVID-19 outbreak. And many of my friends are expecting the vaccine to work like wonders, to work like magic, and suddenly make the COVID go away just like that. I think if we have that in mind, we will be very disappointed, because that's not a realistic expectation. I think we really need to understand that this COVID is here and it's here to stay. And we are entering, and we have entered this new world in which we will have to adapt with it, and we will have to adjust to our new lifestyle, which is also friendly to our mental health. So I think of course, it's a journey. It's not that easy to just switch to a new lifestyle in just like that, but we need to prepare ourselves mentally and try our best to control what is in our control for the betterment of our mental health.
So thank you very much for Mr. Akif Basri, who have I think it's a very new resolution for us also. So next, Dr. Rosina, any New Year resolution? And also...
Yes, Mr. Boon, if it's okay, I'm just going to have you bring up my PowerPoint just for the last time, just to the two last slides, if that's okay, to kind of summarize my thoughts on the New Year's resolution.
Can you see?
Not yet.
Okay, one moment. Okay, one moment from here. Okay.
Yeah, thank you so much. So we'll just start with that slide. So my thoughts on a New Year's resolution as we start 2021 would be to prioritize your mental health, right? And if you take a look at the graphic on the screen, you see that, you don't let your phone lose all of its battery. So ensure that you're investing in your mental health, you're taking care of yourself, you're incorporating that self-care. And another point there on the slide also mentions to be kind to your mind. So being kind, being compassionate to yourself, especially during these uncertain times, even though there is a vaccine, right? We're still going to be kind of in an adjustment period for some months, possibly more years. So really being kind to yourself, treating yourself with compassion, treating yourself really as you would a friend, it goes a long way. And then Mr. Boon, if you'll be so kind, we'll just go to the second slide there. So another great way to look at this would be to view your life with something called hindsight. So instead of, beating yourself up about things from your past, and asking yourself, what was I thinking? Breathe, right? We've really emphasized the importance of deep breathing, and ask yourself a kinder question. What was I learning, right? So what have you learned throughout your COVID experience? And what can you take from this experience into the new year? And I feel like those will definitely go a long way. So I wish everyone a very happy 2021, and it was great being on the panel today. It's actually evening where I am, so it's hard not to say good night, but I hope everyone's having a good morning.
So this one? No.
Oh no, that's the end of my slideshow. Thank you. Thank you so
Okay.
much for your patience with me, Mr. Boon.
Thank you, Rosina. Okay, I think the last question I would like to show to Dr. Shu. Go ahead, Dr. Shu.
Can you share the slide? Because
Oh.
Mr. Boon is always asking me what is my New Year resolution.
Oh,
So I need to prepare the slide. Because I need to inform other people what is my New Year resolution.
One moment. Okay.
And my goal is for 2021 is to accomplish the goal of 2020, which I should have done in 2019, because I promised them in 2018 and planned them in 2017. Is it valid, Mr. Boon?
Oh, that's good.
That's great.
Right. So basically, my New Year resolution is to do what I didn't get to do in last year. All right. And one of the things that I always want to do is to be thin and healthy. But still the body weight is still not in a satisfactory punya condition. So my goal is if you ask me personally, of course to stay healthy and fit. But all right, this is the advice for all of the viewer. All right. And I believe I want to quote back what our Mr. President, Dr. Nazrul Azizi, always told us in each and every meeting. He always remind us of these 5 principles in which he took that from the 7 effective habits of people from the writing of Howard Gardner, in which he said that to be good, to be healthy, and to be a very effective people, you need to have these 5 things in mind, in which we have this ethical mind, in which we should walk our talk, whatever we are saying, and this is what we should portray. And we should have this respectful mind, in which we respect each other value, no matter even though other people values is different from us, but we respect them because this is what they are, this is what we are. And by respectful with each other's value, so we can harmonize it and we can work together. And also synthesis mind, in which you should think before you speak, because the things that come out to your mouth, you cannot take it back. If it is like a boat where you row a boat, where the boat you can always pull it out. If you feel that you are in the wrong direction, you can always pull your boat. However, whatever you said, you cannot pull it back. And this thing will always be in others people's heart. So think before you speak. And also creative mind, staying creative in whatever you do, try to find a solutions. And also a disciplined mind, because if you are disciplined, whatever it is, whether your resolutions, whether at your job, whether at your work, it will help you to plan your way and to make you stay healthy and alive. So I think that's all. Thank you so much for being patient with me. Thank you for other panelists. Thank you, Mr. Boon. Thank you, YoungMind, for inviting me to give this topic today. And I'm very grateful to be with all of you today. Thank you so much. I'm so sorry for any of the wrongdoing. Yep. Back to you, Mr. Boon.
Okay, thank you very much for our all panelists. First of all, I would like to say thank you very much for Mr. Akif Basri. He's a clinical psychologist, and also Dr. Nurul Syuhaida. She is senior psychiatrist. And last but not least, our lovely Dr. Rosina, far away from Canada. So, and thank you very much for all panelists who share their view, their experience to us. So I believe that the point and the experience they share with us is very valuable for us. And as I believe that is the most important. We take it and we practice it in our daily life. That's the most important. So before I end my session, I would like to do some housekeeping for those who are outside there of our viewer. So young scopers and so scopper and young minds, next year, starting from January, we'll organize a talk show every month, twice. So they will include various topics. It's not only included mental health, it's also included a lot of financial issue, I think include the all well-beings. So that's why stay tuned and also stay from our advertisement and also our announcement from Young Minds and also from Scopus. So last but not least, I would like to say thank you very much for all panelists, and also thank for Young Minds to have this platform for us to share and also to share our experience and also to educate each other. That's the most important. So last but not least, Happy New Year and also Merry Christmas to outside there. So I get back to you, Dr. Nazro. Go ahead, Dr. Nazro.
Okay, guys.